Metadorial presents obsessive compulsive disorders. Obsessive compulsive disorder is characterized as obsessions, which are recurrent unwanted, anxiety provoking thoughts, images, or impulses, and this may lead to compulsions, which are repeated acts and are performed to relieve anxiety. Unlike anxiety, which is more prevalent in female, OCD is equally prevalent in both men and women. The causes include genetics. OCD is 5 to 7% more prevalent in first-degree relative. Basal ganglia dysfunction, which may lead to emotional distress, decreased serotonin levels, and conditioning, in which a person becomes conditioned to a particular stimulus that causing him stress or anxiety. It may also be associated with depressive disorders and Tourette syndrome. Tourette syndrome is a neurological disorder that causes involuntary movements or involuntary vocalization, known as tics. The clinical features include occurrence of obsessive thoughts that are followed by anxiety and enforces a patient to do a compulsive behavior. This may cause a temporary relief, but a person is occupied by another obsessive thought and the cycle goes on. For example, a person with clinic obsession will continue to wash his hand for and again. Similarly, a person with counting or arranging obsession will continue to do so with any of the objects. The subtypes of OCD includes contamination obsession with clinic compulsions, hoarding syndrome, symmetry obsession with ordering compulsions, obsession without visible compulsions, and harm obsession with checking compulsions. Here, a person with hoarding syndrome has shown, in which he is getting so hard time in letting go of his objects that he does not have even space to move freely in his room. In hoarding syndrome, a person keeps everything to him, even the broken one or the wasted one. Here, a person with contamination obsession with cleaning compulsion is shown, and on the right side, a child with symmetric obsession with ordering compulsion is shown. The investigation of OCD includes PET scan that shows decreased activity in frontal lobe and basal ganglia, and CT scan or MRI that shows decreased size of portate bilaterally, and electroencephalography that shows marked abnormality, especially over the temporal lobe. The differentials include schizophrenia, depression, temporal lobe epilepsy, Tourette syndrome, anxiety, and panic disorders. The treatment includes pharmacotherapy, behavioral therapy, psychotherapy, and in extreme cases, psychosurgery. Pharmacotherapy includes selective serotonin reuptake inhibitors or SSRIs such as fluoxetine or sertraline, tricyclic antidepressants such as clomipramine, and antipsychotics such as olanzapine, haloperidol, clonazepam, or risperidone, and monoamine oxidase inhibitors. The behavioral therapy includes exposure and response prevention, in which a person is made to gradual exposure to the situation or things that causing him obsessive thoughts, and he learns to manage his anxiety without performing the unwanted compulsions. Similarly, desensitization and thought stopping. In thought stopping, a person is made to identify the obsessive thoughts and then degrade them or discarding them intentionally. And cognitive behavioral therapy, which we'll discuss later on. The psychotherapy include emotional support, reassurance, family therapy, couple therapy, and extreme cases psychosurgery is performed, which includes subcortical tracheotomy or kingulotomy. So CBT or cognitive behavioral therapy includes changing perception in patients' thought, behaviors, and emotions, and it is a single effective monotherapy in milder cases. Thought stopping is another valid technique, and it is used in mild cases in which a person learns to identify the obsessive thoughts and then he discarded them intentionally. So, with proper medical treatment or psychotherapy, pharmacotherapy, the outcome is mainly good. So this is the end of lecture.